Hello, everybody, and welcome to the Dentist Show. We are live. Yes, we are live. Tonight is Thursday, and it's Date Night with Denta, where we have conversations that matter to our community. And today is no exception. We're going to be talking about something that's very, very, very important that's happened in the last 3 months right here on Ghana soil. And I just want you guys to say hi wherever you are watching from. Let me see it in the comments box. I want to see who is watching and where you are watching from. And make sure that, as you are watching, you are sharing your pages. We want to make sure that every information that we talk about, every conversation that we have, we want to make sure that everybody hears about it. And like I said, it's, conversations that matter to our community. And I've got amazing guests who are ready backstage and waiting to come on. Hello, Andy. Hello, Rochester. Atta. Nice to see you. And especially those that are watching via Facebook, please make sure that you do a watch party and then you share your page. All you have to do is just click that share button and somebody else will get the feed and they may be interested in this topic. Hello, Eric. So you are watching from Miami, Florida. Wow. Yvonne, you're watching from the UK. Hello. I can see a lot more of you online, so please do say hello. Abraham from New York. AB, nice to see you. Thank you so much for joining us this evening. And of course, if you're watching us on YouTube, make sure that you hit that subscribe button and make sure that you share your page on Facebook, on Twitter, on LinkedIn. As you know, with YouTube, we have a lot of places in which you can share the link. So let's see, Senor is on. Grace is here. Okay, Amma from the UK. Okay, that's fantastic. I'm so glad that many of you are joining us this evening. Now, before I start, I want to say a big thank you to one of our sponsors that has been supporting us, which is World Remit. So join 5.7 million customers worldwide using World Remit and send money to your family and friends back home. They are fast, they are efficient. You can make your money transfer to family members and friends in minutes by just using your laptop or uploading their app. Download the app. It's very simple to transfer money with World Remit. And I know you're dying to see my face, so I'm going to put my face on now so you guys can see me. Good evening. Yes, we are ready for the conversation. It's going to be a great one. I have very important people on the show tonight, and it's going to be very, very insightful, very educational, as always. And again, let me go back to say a big thank you to Seek VR. So Seek VR was made or done by a Ghanaian, Mary Spio. You can get one of these headphones if you go online to www.seekvr.com and use the promo code DentaVIP. All my buyers, all my viewers will get 10% discount by just using that code on all of her products that she has online. So make sure that you go online and go to www.seekvr.com. And then I have these amazing products by Glow Village. Mami, she's an entrepreneur that's based in the US. She's also a nurse, but has started this shea butter range. And it's actually her birthday. So happy birthday, Mami. I hope that you are watching. Have an amazing day. But you can grab one of these products. All you have to do is just go to www.glowvillage.com and purchase one of her shea butters, which is amazing. I've got one myself, so make sure that you go and grab one. Okay, and then I have one of my favorite shitos, and let me see. Let me see if you can see it. So this is Cassie's Classics, all-purpose seasoning, right? You can go online. She does shito, she does jollof seasoning. Go online and make sure that you purchase one. We're supporting, entrepreneurs, Africans that are doing amazing things, young people. She's only 25 years old and has started this range in America, in Atlanta. She ships worldwide. So go on that, website and order yours. Her shito is amazing. So make sure that you go online and do that. And then I have Vesta London Beauty. So Vesta London Beauty, I've got her lip gloss, which I'm wearing right now. Again, you can go online and purchase one of these. Lip glaze, as she calls it, another young entrepreneur in her 20s. We're growing so many entrepreneurs now, which is very exciting for me. Go online and order one of her lip glazes. So we must support our own. We must support young people that are trying to, set up their own businesses. And I think it's really important that we all support. So if you can go online and you can do that. And don't forget, you can visit the World Remit website and transfer your money to your loved ones. So tonight's topic is all about how Ghana built its infectious diseases treatment center in 3 months. Record breaking, absolutely record breaking. And I'm going to have on the line Senor, who was pivotal to the center. He's a trustee, managing trustee of the Ghana Coronavirus Fund, which is a private fund and collaboration that they have done, and they've been able to achieve a lot. Dr. Amma, who I call her, Dr. Amma was also very supportive and also managed to get a lot of people to donate. And I want to hear from her because, as Ghanaians or as African people, I feel like sometimes we don't donate as much as we should to good causes like this. So how did she manage to encourage, fellow friends and people to put money into this fund to help with this infectious diseases treatment center? And then I have an infectious diseases specialist, a doctor, Dr. Bertha, who I love very dearly, very knowledgeable in the area and her field. And I'm excited to have her on the show. I was on her show last weekend. She had an amazing, what's it called? For young kids, they had to write stories or poems. And it was just really, really insightful to see how young people have an amazing writing skills. And so she's going to be joining me on the show as well. So I think the first person that I'm going to bring on Dr. Bertha. Doc.
Hello.
How are you this evening?
I'm wonderful. Thank you.
Thank you so much for joining me on the show. I know you're very busy, but you took out your busy schedule to join us on tonight's show.
Yes.
So Doc, tell us a little bit about yourself, your role and what you do, and how infectious diseases, as an infectious diseases specialist, what does that mean? What do you do?
All right. So thank you very much for having me on your program, and a big hello to everybody watching you. So an infectious disease specialist is somebody who has completed medical school, does a subspecialization in what we call internal medicine, or sort of doctors for adults, although there are pediatricians who can subspecialize. And then you spend another 2 years just learning about different kinds of infections. And the idea is that you'll be able to manage almost every infection that exists or known to man in a special way, and make sure that you've gotten the dose right, the diagnosis right. And so on a daily basis, what I do in the hospital is if someone comes into the hospital with a very difficult problem that they can't find, maybe they have a fever, or maybe sometimes a diagnosis has already been made, you would go in, evaluate the patient, come out with the correct diagnosis, and you will prescribe the right medication. So sort of like you're the doctor's doctor, or to put it in layman's terms, you're like the detective doctor who makes sure that if there's any infection anywhere, you are able to find it and come up with the right diagnosis. In addition, we have some infectious disease doctors who also work mainly in research. They do research to find out the trends of diseases or see what can be done to fix certain things. Some of them are into vaccines. So that's what I do. But since COVID-19, the pandemic, not only have I been taking care of COVID-19 patients, I've been doing a lot of education, engaging young children like you saw last week. And we have an organization here in the United States, the Ghana Physicians and Surgeons Foundation. So we've started a weekly sort of highly educational webinar for physicians, bringing them up to date on the latest research. And so tomorrow, for example, we're going to be discussing chloroquine and the debate, hydroxychloroquine, and the data surrounding whether to use it, should we use it, should we not use it, what are the pros and cons, etc. So that's what I do.
Mm-hmm. Fantastic, fantastic. And I know that the kids were wonderful. I mean, the way they use their imagination to write about COVID-19, how they were feeling. You know, some of them even learned new skills about braiding their, you know, learning how to braid hair or learning new skills whilst during COVID-19, which I think was very inspiring to have such young people between the ages of 13, you know, come out with these initiatives.
Right, right. It was quite inspiring for me myself.
Fantastic. Now I'm going to introduce Senor, my brother Senor. Hi, Senor.
Yeah, hi, Denta, and hi, viewers of the Denta Show. This is a fantastic show.
Senor, it's good to have you on.
Same here, same here. It's a pleasure.
Oh, it's good to have you. It's good to have you. So, Senor, before the Infectious Diseases Center project came about, what were the other projects that you were involved with before we dive into that?
Well, the first thing that the fund did was to probably give a little background on the fund so you probably situates what we do. The fund was set up by a set of private people, and our object was actually to provide a swift response or very swift interventions in support of government's general intervention.
Before the fund. Senor.
Well, before the fund. Well,
Senor,
hello?
before the fund, what were you?
Yes.
Yeah, so I see that the Ghana Chamber, I can see your background and where you work. I want to know a little bit about you first before we talk about the fund.
Well, okay, so I run the Chamber of Bulk Oil Distributors, which represents the bulk oil, the oil petroleum importers and operatives. So largely that. And beyond that, I also am managing director of the Legacy Bonds, which is an SPV owned by the banking sector and the petroleum sector, largest subscribers to Ghana's energy sector leverage bonds. And I also advise the government, advise the previous government and the current government as well. I'm an entrepreneur too, quite long on the agribusiness sector. So you can call me a rice farmer and a rice miller as well. And that's largely me, save for other social things I do. But then the fund, which is also
okay. So what makes you get involved in that?
I didn't hear you. Hello, Denta. Hello, Denta. Can you hear me?
Sorry.
Hello.
You can carry on, Senor. I think there's a little bit of a... I can hear you. You can carry on.
Okay, so then came the fund, which was an idea that started practically, I think, on the 25th of March in a WhatsApp conversation between myself, Tony Otinjesi, and then later Mr. Ediefa, a conference call on the 26th. And by the 27th, we had actually set up a fund. And on the 29th, we had actually officially birthed the fund. And thereafter, we had the lockdown starting on the 30th of March. And we observed that government didn't have any special intervention at the time for the deprived persons who were going to be affected by the lockdown. So the first thing we did was to come up with meals, hot meals, to serve the Kayaye, the headquarters. And we went beyond Kayaye. We also did other underprivileged people. Eventually, we ended up feeding about 10,000 people in Accra and 5,000 people in Kumasi each day over a period of 10 days for the first phase of the lockdown. We also observed government intervene at some point, and we decided to step back and refocus our efforts in other areas. And the key thing we're looking at thereafter was supporting the medics on the front line with tertiary care PPEs. A lot of us were doing the very standard gloves, but there were other key things that they really needed for ICU care, which was lacking. So we intervened, directly supporting the National Center for the COVID-19 Case Management. In that engagement, we also identified, thanks to cooperation from the Ghana Medical Association, and hopefully Dr. Justice Yankson should be joining us and will shed a bit more light. We realized that we had a major problem as a country. We thought most of the facilities that existed at the time, and the Mark touted Ridge, which was supposed to be the center for COVID-19 management, just had 4 COVID beds. 1, 2, 3, 4. 4. And that really got us alarmed and realized we needed to come up with some intervention. We tried to pull our resources conceptually, and we're actually thinking of something swift. We're looking at temporary structures, just like we saw happening in the UK and other places in the West. But Justice Yankson and his colleague medical doctors like Dr. Chris O were quite adamant that Ghana had a unique problem. Our problem was not just spaces to just hold people. We actually didn't have an infectious disease center, a professional place to really take care of severe cases and critical cases as far as infectious diseases are concerned. So if we really needed to support the system, we really needed to invest in an infectious disease center. If we were just looking at isolation, we may as well just use our university hostels and accommodation to do that. That was a game changer. We initially didn't put much weight on that, but as we researched the recommendations, we realized there was a lot of validity to that. And beyond that, even trying to assemble the tents and all that in time is going to be a problem. It's going to take us 3 months. So if we're going to spend 3 months, why don't we just spend 3 months doing something that's more competent and permanent and sustainable for us as a country? That actually birthed what we ended up calling the Facility 100 project, which has the first of its kind now in Accra. And beyond that, we are now looking at having that in Kumasi, Tamale, and Takoradi to take care of various belts across the country. All these areas have unique infectious diseases that attack them at different times. One of the key things we've been trying to avoid is infections by medics in the process of treatment. So it is quite a specialized facility, very different. I'm sure Bertha would educate us a bit more from a standard hospital. The workflow is very, very different. So I had a lot of friends saying, there are a lot of hospitals around that may not have been commissioned. Why don't you just get that going? I said, no, the workflow in all the standard hospitals are different from the workflows that you need in an infectious disease center. And we hope that this will actually be the base for building Ghana's future CDC, which is a Center for Disease Control.
I think it's fantastic, and you guys have done an amazing job. I'm going to invite Dr. Justice Yankson to also get his perspective on it and how he got involved, because I hear there was actually your idea, Dr. Justice. I mean, you felt that this was very much needed in our country. And you came up with the idea and brought everybody together. Tell us a bit about what you do and how you played such an important part in this conversation.
Okay, good evening and good evening to everybody.
Good evening.
Great. It's a pleasure being part of your program tonight. This is a story that we'll need to share for others to learn from and also to motivate all of us. But baseline, I started my work life as a medical doctor, and I'm still a medical doctor. I also practice law because I graduated from the law school about 10 years ago. And I have a bit of background in finance as well. In fact, I do a lot more of pension funds and pensions generally. pension fund management, and pensions generally. That has been one of my key areas of specialization. But like Sarah said, for whatever reason, he's my good friend. I also happen to be a farmer one way or the other. I do a bit of cattle and a bit of plants, cocoa, stuff like that.
Oh,
and
wow.
I'm also an entrepreneur.
So, Doc, how did you get involved in the fund? What part did you play in all of this?
Okay, it all started when my good friend Senor Jose just gave me a call one afternoon that, bro, there's something that we need to talk about. You need to come over quickly. And it was a weekend. I was like, oh, could we just do a bit of time later in the day? He said, no, it has to be now. So I drove to the meeting point, and he said, look, this is the idea a few of us have been thinking through. How can we all pool our resources and expertise together and ensure that we help out with this whole COVID pandemic? At that time, I said to him, bro, that is a good idea, and we just need to focus. So you just tell me what you guys have been thinking about so that we can look at the way forward. Then he gave me a bit of a background, the way, about 2, 3 people had thought of it and what have you, and the decision that, look, we need to launch something and go into some form of, activity to help. So all the things is mentioned, the KIU, the feeding of the front lines, provision of PP, all these things were things that we rehashed, just over a few minutes. But at that point, the commitment was strong. So quickly, the launch of the fund happened. And then, as they say, the rest is history. But we needed to act quickly. The lockdown was on. The first activity was the Kaya bit, where we were all over the place, Apoploshi, Malata, Circle, Tema Station, Dakuman. We went into, with all due respect, very, very deprived areas, but we supported our own, So whilst we were doing that, we were also planning how to execute the other projects. So concurrently, we started off with the PPE, but we went for the high-end specialized ones like the Tyvek coveralls and what have you. We were not doing the usual that everybody was doing. And then we got into planning this whole center properly. And like Senor said, the idea initially was one that we were just going to provide a tent. It took a bit of time, I might say, to convince the other trustees that, look, yes, the tent may solve some short-term problem for us, but it was not what we needed. So we needed to do a bit of what the military guys would say, recce, for me to be able to really convince them. So we looked at the only tent we could get in Accra at the time, which was the one at Elwak by the military. I also took them to Rich Hospital to look at the 4-bed beds. We met the military, hierarchy, especially those from the medical wing of the military, to discuss all these things. And then gradually, I realized that the trustees were beginning to agree with me that we needed to actually create a permanent structure. But it was still a bit difficult because siting was also another thing. We looked at the structures at Rich and we thought that it wouldn't help. Finally, with a bit of difficulty, and that one I always praise Senor, when we left the military base, at Burma camp, I told them, bro, we need to get straight to Gais. At the time, Gais had just started as the National COVID Treatment Center. And to be honest with you, some of the people were, I don't want to say scared, but a bit hesitant because we had some elderly folks, and the narrative about COVID at the time was, such that people didn't want to take chances. And I had to convince them that, look, 2, 3 days earlier, I had been there to do some other work, and that it is still a safe area for us to go. Luckily, we went in, and on that same day, we were able to appreciate the fact that, well, this is it. But before we did that, I just told them after one meeting that, look, let's just go to the health minister's office. And this was without any invitation. But of course, I had a good relationship with him. So we got there and I told him that, look, this is it. We need to talk. He opened his doors. We spoke and then he agreed with us. And he said that, look, let's go to the president. So quickly, the next day, we went to meet the president of the land. He gave us his blessing. And then finally, we chose the site at East. And that is how this whole bit started. But I'm sure as we go through it, we'll get into a lot more of the details. But another good thing that happened along the line was that while Senor was trying to get a few architects to put something together, I also was doing something on the side with the built environment professionals. So I sold the idea to the trustees that, look, I have these guys who are also ready to help. Should we invite them? They said, you can go ahead. So whilst we were choosing the site, I called one of them, Kofi Eselapia. He came to site with us, and then subsequently they also joined. But the story itself, I'm sure, will evolve as we go along.
Absolutely, absolutely. And I just want to say a big thank you to you, the team, for doing this. You've made it look and seem that everything is indeed possible if you put your mind to it, if you are persistent, and if you keep pushing. Because, you know, a lot of people that are doing business or even want to come from the diaspora to come and do things feel like it's very hard to work in Ghana. And I know that you touched on the part of, you know, there were resistance. It wasn't easy. But at the end of the day, you got it done. You know, that's the main thing. You actually got it done, which is very, very inspiring. And as you can see, the comments are just flowing in. People are just inspired and are just realizing that, look, this is the future. If we can work in this way, then so many other things are possible in our community. And so like you said, we will touch on that. But I want to bring on my last speaker, last but not least, Dr. Bettina. I call her Dr. Amma. Again, she's a doctor, and she was like, I'm going to get involved. I'm going to get people to, you know, she's going to get people to put in money to help with this fund. So let me just invite Dr. Amma on. Hello, Doc.
Hi, how are you, Denta?
I'm very well, thank you. Doc, I just want to say thank you so much for believing in the project and for also, you know, doing your part in getting people to donate. I mean, you got over $25,000 to be put towards this project, and that's a large amount of money. How were you able to get people on board? Especially COVID-19, where there's not a lot of money flowing around, you managed to get people to come on board.
Well, I always say that sometimes people just, you know, become a lot more aware when there are issues like this, and then you'll be surprised. There isn't much money, but they're very giving at times like this. And of course, you have to be able to convince them that it's worth giving towards this cause. I mean, I have quite a few influential friends who I hear giving their money, you know, I always hear them, their philanthropy is more going towards certain projects that I may not necessarily agree with. So once I heard about this through Kweku, Senor, I knew those who were involved. I said, well, I may not have $25,000 odd to give out for this project, but the least I can do is just to try and rally people around to get some money for the project. So I just said to them, it's a very simple message. Today, it would be somebody else, but tomorrow it can be you. As we've realized, COVID is no respecter of persons. You've had people very high up there in government, in public sector, and the private sector. You've had young people, you've had old people, and especially my friends abroad in the diaspora, which I know is your main interest. I just kept hounding them and telling them that, you know, you have relatives back home. You may think that you're doing exceptionally well there. You have a very good healthcare system. But if your mom is unwell, or your father or any relative of yours or a friend of yours is unwell, we have to be able to have a good place where we can take these people to. So I would, you know, I would suggest that you contribute towards this fund. And strangely enough, people were not, people were quite good. I had a very big donor, and you'll be amazed to know that he's not Ghanaian at all. He has just settled in Ghana. And with one sentence, he's a patient of mine, a very good friend of mine. With one sentence, I said, you know what, XYZ, you've got to help us because I know you put your money into other things that you don't want to talk about. But for me, this is really important. He said, Amma, once you are involved and once the money is going through you to wherever, I know it's going towards a worthy cause because, of course, I'm a physician. So bam, he gave us a huge sum of money. So I called Kweku Bediakon, who is one of the trustees, and I said to him, this is what it is. And he said, fine. He's not Ghanaian. He may not even benefit from this system. So my point is that if you're Ghanaian, you can afford it, and nothing is too small. People seem to think, oh, if it's not $1,000, then I better not bother. But whatever you put into it, definitely, would go towards something. If it doesn't go towards a bed sheet, it will go towards a bed, it will go towards some equipment or something. So I'm looking, I always look at donors from very little to people who will give tens and hundreds of thousands of USD.
Absolutely. And
Kelly,
do you find, Doc, do you find...
Can you see me?
Yes, we can see you. Senor, we can see you. We can hear you too. Okay, Doc, do you think we are given as a... I mean, you said that the largest donor that gave money was non-Ghanaian. Do you think as us as Ghanaians, we're actually donating to such causes?
Sorry, I missed your question. Do I think other...
Do you think that Ghanaians donate as much as other nationalities? Do you think that we are giving in times like this?
I think, there are so many projects that go on. And you see, it's very upsetting when you give money towards a project and you see that it has stalled, or you see that it is not going necessarily towards what you have contributed to. And this is what most people said when I approached them to help. However, I was so sure of this project that I was putting my head out for. I mean, when you look at the list of trustees, when you look at the military getting involved, when you look at government giving them their full blessing, when you look at people like the architects and the engineers who gave, their services for free, and you give towards such a project, that it's going to go towards a good thing. The point I'm making is that I think Ghanaians are giving, yes, but because we've seen so many other things that you have contributed towards and do not see the light of day, it just makes you a little bit wary when you're going to give your money, But in health and when you look at the people who are involved, I mean, with this project, I didn't have much stress, getting Ghanaians to get involved. So I think that's pretty much what it is. I don't think we are that much different from the odd African or even people abroad or Europeans or Americans or whatever. But pretty much, I'm giving my money. The Ghanaian says, you know what? I'm giving my money and better make sure that it goes to the right place. And I see that the project exactly. So this is what I find, because I do quite a lot of fundraising for projects and other things that are not for profit. And I get people giving when they are sure that their money is going to the right place.
Yeah, that's true. That's true. Doc, I mean, I know that you're a medical doctor. Please share with us, what you do on a daily basis. I know that you were, or us, I don't know if you still are, Dr. Kufuor's, ex-president Dr. Kufuor's, doctor. And just let my audience know how important you are, because you're a very important person. So please tell us a little bit about yourself.
Well, I don't know about the word important, because everybody's important. But
you are.
I believe in public service, and that's just what I have done all through. I mean, initially I started with public service, Kolebu Teaching Hospital, went into Akai House Clinic as a doctor. And then I came out, worked for President Kufuor, as you've mentioned. And with our profession, you don't see a patient, and when he's president and when he's no more president, stop seeing him. So he's still my patient. I'm still his doctor. And then after that, of course, after he left office, I went back into the private sector. So I'm now a medical director of Calvert Clinic, which is a clinic that I set up in honor of my father, who's a renowned pediatrician who taught in the Kolibu Teaching Hospital to the age of 86. And so I set up this clinic in honor of him, and that's basically who I am. I do a bit of philanthropy, and that's why I got involved in this. I have a foundation, the Menfit Foundation, that mentors the youth. So it's not all medicine. Sometimes we have to step out of the box. I'm not here today as an infectious disease specialist or any such person. I'm just here as Senor would like to say, I'm just here raising funds towards a worthy cause. So pretty much that's me. So important, I'm not sure.
She's a project ambassador.
Sorry, Senor, I missed that.
You are the project ambassador.
Oh, it sounds very cool, and I like to be a project ambassador. Thank you very much. But it's amazing. It's been just amazing.
Look, I mean, one of the questions I've always wanted to ask you: how is it like being a doctor for a president? I mean, what goes into that? Are you like? I mean, I just want to know, how is it like? Because what do you have to do? Do you have to be with them like 24 hours, or is it that you like when they're flying out, you're with them? Like, what? How is it? How is your daily life with a president?
Benta, I'm going to whip you, because this program was not about me at all. And I'm not very happy with you.
But now I have to get this one out. Now I have to get it out.
No, I mean, of course, this is the highest man of the land, and definitely you have to make sure he's in perfect health. It is not easy, because when somebody gets a cold and a cough, it's okay. But when you have a president having a cold and a cough, coming to sit on public television and sneezing and coughing, people are going to be like, who is his doctor? Why isn't she doing her work? So pretty much what I'm saying is that you have to be with them most of the time. Of course, they have their private lives, and therefore we leave them alone to enjoy a bit of private life. But pretty much I spent the time with him. Of course, it wasn't just me, and that is very important to mention. We're a team, and we work together as a team. So that's what. But that's the end of Dr. Amma. Back to infectious diseases.
Back to infectious diseases. And I think I'll come to Dr. Bertha. I mean, how important is it to have an infectious diseases center? I think Dr. Justice said, or Senor mentioned, that, you can have a hospital and it has maybe a bed or two for infectious diseases. But how important is it to have a center, especially for it?
I think it's extremely important, and we have one here in the United States. But I'm excited to be on this program, Denta, because it ties in very directly with my own personal vision. Believe this or not, but I drew up a plan for an infectious disease almost institute or town about 10 years ago. I know I've shown it to the Ghana ambassador. I've shown it to President Rawlings. I showed it to the ambassador before, Dr. Beria. And so 2017, I set up a Global Infectious Disease Institute. It's a nonprofit to raise funds for exactly something like this. So when I heard it happening, I was super excited, because I'm trying to straddle between two worlds, the US and Ghana. But Senor and Dr. Youngson are on the ground, so they were able to get it off the ground. But why did I have this vision? So you realize that we had the Ebola outbreak in 2014. And at that time, around the world, there weren't even many infectious disease centers. But after 9/11 in the US, one of the doctors from University of Nebraska Medical Center, Dr. Phil Smith, who is an infectious disease doctor, thought about building a biocontainment unit just in case somebody tries to do something with bioterrorism. Which hospital are we going to keep this person in? So he set up the biocontainment unit, and you realize that when the Ebola outbreak came, everybody was a little afraid, because if you take these patients to a regular hospital, they might transmit the infection to others. So you realize that the one patient who was brought from, I believe it was Sierra Leone to the US, was taken straight to this facility. Now, since then, the United States, and this facility was a 10-bed, what they called a biocontainment unit. It was the first of its kind in the United States. After the Ebola outbreak, the US government saw the need that we need to have specialized centers. And so Dr. Phil Smith was commissioned to go around and set up similar centers around the country. And so they were able to come up with what they called a regional tier system, where in the US right now they have 10 treatment centers, which has a catchment area of about 400 miles. And then you have access centers and frontline, what they call hospitals, to assess somebody with a potentially highly infectious disease. So this is United States. Their history of doing this is only 2014, so about 6 years. But the federal government has given lots of money. And actually right now, as we speak, the Nebraska Medical Center has the nation's first quarantine unit with a loan of about, well, not even a loan. The federal government pretty much gave them $119 million to build this global security center, and 19 or 20 million of that went to this facility, which is a quarantine facility. So let's fast forward to Ghana. What does this mean for us? There are so many infections, like this COVID-19 came, it's highly infectious. Healthcare workers are getting infected. It is extremely important that Ghana has a specialized hospital, not just a hospital, but the staff, the human resources have been specifically trained. The outlay of the facility reduces the risk of infections. Said that if somebody has an infection like that, they will take them to the center, they'll get the best care, and the healthcare workers who work there would have the right training and everything that it takes to provide the best care for this individual. And I like what Senor said, that it's not just Accra. We need several of these. Why? If somebody has a very highly infectious pathogen in Tamale, you want to be able to take care of that person there or quickly assess them and still put them somewhere close to home instead of the risk of transporting them all the way to Accra. And so I think that in the grand scheme of things, this center is extremely important. And I think in the long-term vision, not only do we need hospitals, the vision that I have in mind, which when we fully fledge it, it should be a place where research is also being done. You have a lab attached to it. It can be a reference lab, but it's sort of like a one-stop shop where for every type of infection, you can come to this center and get the best care possible. And the patient, you can be assured that just like they brought the Ebola patients here and they didn't die, most of them survived. You can be sure that in this center, because it's so specialized and complex, the would survive when they bring them in here into that center. So this is a major breakthrough, and I applaud Senor, Dr. Youngton. Everybody who was involved has done amazing. And to the regular everyday person in Ghana who gave 1 cedi, 2 cedis to make it happen, this has been really fantastic for this country.
Doc, you mentioned that, you know, with the US, the government pumped in quite a large amount of money. Do you think that this should have been done also in Ghana?
I think, yes, it should. But whenever I hear the president speak, he talked about building Ghana Centers for Disease Control and 3 infectious disease hospitals. I'm not sure if in the grand scheme of things, this was before Senor and his friends had thought about it or afterwards, but I think it's in the government's plan and thinking, and it should be, because the world is changing. We don't have to wait for another pandemic before we take that initiative. Just like in the US, they didn't think about it from the beginning. It was after Ebola that they went, you know what, we need to invest in this. And Congress actually voted. This was an act that was done through the Department of Health and Human Resources. And so they actually have an assistant secretary who manages a department called the Emergency and Response Center. So we need to start thinking ahead. It's not so much putting up hospitals. We need to have a department in our healthcare system who is thinking about biopreparedness, emergency planning and response, and supporting initiatives like this and assisting with public and private partnerships. So yes, the answer to your question is that in the US, it was the government that actually pumped out the money, 119 million, and there was a lot of money to upgrade, shore up a lot of hospitals. Massachusetts General Hospital, Johns Hopkins, there are 10 hospitals around the country at this time that are ready for any patient with any type of, highly infectious disease or but that requires something that requires biopreparedness. So yes, the government should play a major role, and the private sector as well.
Fantastic. So I'll come over to Senor. What are some of the goals and objectives of the newly built Infectious Diseases Center?
Okay, well, before I give an answer to that, I'm going to respond to something that Bertha raised. Bertha, just for your information, the facility has incorporated in it a laboratory, 2.5 scalable to 3, just a few more equipment we need to add. So practically, we've actually built the base infrastructure for a category 3 laboratory that should be able to deal with almost every sophisticated and infectious disease. And we're actually looking forward to it actually be a training base as well. I think Dr. Justice Jansen may be the best person to probably add a lot more info to that. What our objects are, Brenta, right? If I probably heard you right. Well, the first thing for us is to have this immediately deal with the current crisis on our hand as a country, COVID-19. But more importantly, it has to be strategically positioned to serve as the base for the development or the setup of Ghana's Center for Disease Control. I don't think it's acceptable that after so many years as a country, we've not really had infectious disease center. When we are surrounded with by so many infectious diseases from CSM, cholera, Ebola, I mean, any of these can emerge, re-emerge, recur from time to time, and we must be prepared for it. We need to equip them with the right kind of personnel. And we have quite some trained, skilled persons in Ghana. We just don't have the right facilities for it. So this should actually serve as the base. We are hoping that together with the other 3 we hope to develop, we should actually have a full base for establishing a viable center for disease control in Ghana, and not just serve Ghana, but actually serve the region to the extent that it can. We currently operate a helipad in one of these facilities, so we can actually have people fly from neighboring countries, pick them up from the airports, and land them right there. So it actually becomes both a training, a research, and a treatment hub for West Africa. I think that Justice may want to shed some more light into this strategic thinking, which has been one of the key debates in our handing over in the last 1 week.
Yes, Dr. Justice, can you add to that, please?
I mean, like Sarah said, our plan is to ensure that ultimately there's a Ghana CDC. We strategically chose the locations of the facilities we want to build. So Accra for the southern belt, or let's say Accra and Takoradi for the southern belt, which is highly populated, Kumasi for the middle belt, and Tamale for the northern belt. Now, what we have put on paper and we are discussing with government is that we think that this infrastructure that we are putting in place should be the catalyst for the Ghana CDC. Of course, government has also promised that they're going to put together some 3 other ones. So since we have started it, it's up to government to see how they will, in quote, fit into this arrangement properly with the ones they want to put up, such that within the next 1 year, Ghana as a country will have a fully fledged CDC and also quite a number of infectious disease centers to take care of us. And like Senor said, we are even looking at a situation where we can even help our brothers and sisters in our neighboring countries or in the sub-region. The helipad he spoke about is something that we are currently, at work on. And it is also going to help fly in people in other locations within the country who may have difficulties accessing these centers. But of course, the whole idea is that this facility should be one that will be out there, not for the short term, but for the medium to long. And we strategically positioned it such that it is going to be fit for purpose by way of teaching, by way of research, and of course, the management of the cases. And that is why we made sure that we incorporated certain features. Senor mentioned the laboratory, for instance. This is a level 3 biosafety lab. All the bits that you need to do, it's out there, and it's going to serve a certain purpose. As we speak, with our PCR machines and what have you, we have incorporated. These are supposed to serve the needs of those in the facility, as well as help the nation generally in its testing capacity. We have a very difficult, terrain. We didn't have a lot of capacity when it came to testing. Noguchi, KCCR have been the main centers. But with this coming on board, it is actually going to help. And this is going to help with diagnostics, as well as teaching, as well as management. So we are looking at a comprehensive thing. One feature that we carefully selected was our intensive care unit. When we looked at our resources as a country, unfortunately, the intensive care area was one that we really, really were found wanted. And mind you, whatever we had was to basically care for everybody, not those with infectious diseases. So it's at this point we even decide that we're having splitting it into two, because you have a pandemic. Half the number of ICU beds for, in quotes, the COVID-related problems, and then another half for the general population. The situation is going to be worse. And then we made sure we put in a 21-bed ICU, which is the highest number of beds in any ICU for one facility or one center in the country, including the teaching hospital. So we've carefully selected these things, and we've made sure that the staff who are also going to work in an environment that is free of potential danger. For example, we made sure that we created a negative pressure within the facility. It may be a bit technical, but the essence of it is that that singular activity does not allow any contaminated air to move out of the facility to the general environment. And any air that is produced within that facility is carefully extracted, filtered, and passed through radiation, UV radiation, to destroy or kill any microbes before they are released into the environment. We've also created blocks for the medical personnel that will help them in their planning activities. So they have meeting rooms, they have conference areas where they will actually sit, plan, and move in with precision to take care of the patients. Of course, we provided an ambience that is conducive for work. So they have a lounge, they have kitchenettes, they have rest areas, and what have you. And these are all clearly separated from the rest of the facility, but still linked. And these are some of the features that we felt that, look, as a country, if we needed to do something to serve the purpose of which it was intended to, we needed to look at our peculiar problems and address them all within this structure. And as we say, it is 100 bed, 100 bed, but in truth, it's 108 beds.
This is fantastic. It gets better and better.
We've been quite energy sensitive. So the facility is currently EDGE certified. Well, EDGE certified by the IFC EDGE World Bank because of its green characteristics or features. The entire building, both the walls and the roof are insulated because you have a climate controlled system. You have, ducts everywhere. You don't really have that in hospitals in Ghana. Right? It's a very modern facility. To run that, you need a lot of power. So if you don't minimize the energy consumption of the place, sustaining the facility will be a challenge. So we've injected sustainability features in that. You find skylights also minimize the dependence on electricity powered lighting as well. All right, the facility has been designed not just by ourselves, but with proper consultation with all the key actors. The lab, for example, was designed, let me put it, redesigned by Noguchi. We have to consult Noguchi, which is the foremost research laboratory in Ghana, in this entire design exercise, so we can actually meet ISO certification and help the entire hospital meet JCI certification. That's the goal. We need to get something modern, something competent to fit the purposes for which it's been built and to compete with any infectious disease center in the world. We deserve the best too as a people.
Absolutely,
Well,
we do.
just to add a quick one, you know what Senor said with the Noguchi bid, we strategically selected Noguchi to be a partner because of the research aspect of what we were going to do. Once we had a lot of infectious disease cases that were going to be handled in there, we needed people within the research environment, including medics generally, to be able to work closely with us in that facility. So that was one key reason why we also decided that we should let Noguchi be a part and take charge basically of the lab. But all other things that can be done in any laboratory, from the chemistry to the hematology bits, all of it are still in there, not just the PCR and infectious disease component. It's a total thing we are looking at. And another feature that probably Senor hasn't mentioned is that all our painting with the floor, the walls have antimicrobial properties. The paints that we use, they have antimicrobial properties, and this is to ensure that we don't have growth of pathogens within the facility. Of course, the standard infection prevention control measures will be in place, but the building and its facilities are designed such that it helps minimize spread of infection, which is very key because the health professionals also need to be safe. The building itself has some insulation that ensures that, as my engineer friends will say, it's a 0.25 gram or 0.25 G fire safety facility, and it translates to about 2 hours of fire resistance, at least. That will ensure that even if there is a call out there to the fire service to come in, by the time they come in, relatively the facility will still be intact because of the kind of fire insulation and all that we have created within. So we carefully thought through. And we think that as we go forward, probably we can even improve it. But this is one of the best you could get anywhere. And the design, one thing about it is that we did not leave the practitioners, the healthcare providers themselves out of the design. Most at times, facilities are built without any input from the people who are actually going to use it. So right from the design stage to completion, the medical professionals or the healthcare professionals generally have been part of the design and construction of the facility. I mean, I can say for sure that one of the reasons why we couldn't even complete this within 3 months, the first 6 weeks, in spite of all the other difficulties, were as a result of some variations that the Medical Association asked for. And of course, being the General Secretary of the Medical Association and being part of the project, I made sure that the trustees all agreed to these variations, and that also prolonged their time. But by and large, even building within the 3 months is still a very, very good thing because of the difficult circumstances we find ourselves in with the lockdown and then the closure of our borders and international borders generally, and the problems within the supply chain. So we carefully thought through a lot of things.
Absolutely incredible. And for me, Dr. Jenkins, what I want to know is that this building is absolutely spectacular, but what about the talent, the people that are going to be working in this facility, the qualifications, how we're going to be able to manage? It's all well and good having the building and, everything inside, but who are going to be managing what's inside to make sure that when somebody comes in, they get the right treatment?
Okay, what we've done is that, first let me state this. Ghana as a country has quite a rich base of human resource, both locally and internationally. And our plan is to tap into this human resource. Of course, we've handed it over to government, but we did not just hand over. we came out with a comprehensive document that basically is pushing government to ensure that only the right people with the right competences and expertise are the ones who are going to man this facility, not just from the healthcare provision aspect, but even from the hospital administration angle. And the fund itself is ready to support one way or the other. As trustees or working together with the trustees, we have developed some models that we think will help support these facilities that we are going to put up within the medium to long term. Of course, government will still have a certain responsibility to ensure that they provide and cater for the human resource. We cannot continue to employ and pay the human resource and run the place as if it's our private properties. No. But we want to leverage on the system and the human resources within, but making sure that we carefully select those with the right competences to man and run the place.
Yeah,
Okay,
and then maybe I can speak a little bit to this. They got, I belong to an organization called the Ghana Physicians and Surgeons Foundation, and it was set up mainly to help the public health of Ghana and to help with graduate medical education. And we have determined as a group that we will do everything we can to support Ghana's health system. And actually, since the COVID-19 outbreak, we formed a WhatsApp group called the Joint ICU Initiative. And we've been working with our colleagues actually quite actively. And today, Dr. Owu was kind enough to mention it during one of the Africa CDC lectures that he gave, that we've been working closely with them to see what we can do to support in terms of knowledge. And in fact, the weekly series of education that we've been doing is part of the initiative. But the government has reached out to us with data showing that we don't have enough healthcare resources and human resource, and we can't run away from that fact. In fact, the WHO recommends that the ideal doctor to patient ratio should be 1:1,012, and we are at about 1:7,000. So clearly for every doctor in Ghana, they have to take care of 7,000 people. So clearly we don't have enough. So at this point, we're in the process of even looking among ourselves. What can we do to help for the various subspecialties? Now, for infectious diseases in particular, I don't think Ghana has even more than 15 infectious disease specialists. And how do I know this? Is because I've reached out to them. The dean of the University of Ghana Medical School, Professor Margaret Latte, was one of my senior colleagues. She's an infectious disease specialist. And I know that on average, we're growing about maybe 1 or 2 per year. And so what I have done on my own initiative is I reached out to them and said, you know what, let's form something called the Infectious Disease Society of Ghana. And I'm actively calling around and recruiting infectious disease doctors. I just found about 2 or 3 of them even this week. When I do that, I add them to this group so that Ghana will have a core not a core group of human resource with specific knowledge in infectious, because the centers I'm talking about in the US, they're not being handled by primary care doctors. They're not being handled by public health officials. They're being run by infectious disease specialists. So from our perspective as diaspora physicians, we're doing what we can to get the human resource in place, even if it's not to be on the ground. These days, even in the US, a lot of care is delivered by telemedicine. You have radiologists in one part of the US reading X-rays or CT scans in another part of the US. You have intensive care units being managed by people who are miles away. So I think that from the human resource perspective, yes, in the healthcare sector, people have talked, okay, all these buildings are going up, who is going to man them? And I just want to say that, yes, the government has reached out to us. We're in talks with them, and on our own and personal initiative, we're getting ourselves together to be able to provide that backbone. Because realistically, if you think about it, we are where we are because Ghana used their taxpayers' cities that were used to train most of us. So we're in a position where we're ready and willing to come back and help in whatever way we can. So that's just one piece I wanted to add about the human resource.
Sorry, Denta, can I come in?
Yes, please.
Yes, I'm very passionate about this particular area because I'm not only looking for funds. I'm not only, asking for money. I'm on a group, of course, my year group. Probably about 60 to 70% of us are abroad, and I qualified over 22 years ago, and we are, quite a lot of us are abroad. So it's wonderful that Bertha is saying that we should. They are helping from outside, but in my conversation with my year group and other doctors who are outside, I keep telling them that, it's wonderful if you can be like Bertha, who has one leg here and one elsewhere. Because if even during your periods of coming on vacation or you're taking something or something, it will be very useful for you to come back home at some point to come and assist, because of course, like she's saying, that we were all trained with the taxpayers' money. It's lovely for you to be out there and also help us here by virtue of what people like Bertha and co are doing, which is very laudable. But then coming back home, at some point to just come and assist. Because I'm sure Dr. Youngson and co they are in the public sector pretty much and they know what's going on there. We have been in private sector for a while, so sometimes you're a bit out of touch. But I can say for sure that for something like the ICU, I've been speaking to my colleagues because I'm managing quite a few COVID patients remotely, those who have home management. And so I've been speaking to my colleagues who oversee the treatment centers and all of that. And then they keep telling me that, it is not, necessarily about the beds. As for the bed space, is fantastic. But you know what ICU is. ICU is ICU is ICU. You need care per patient, So we'll just entreat our colleagues out there. As much as I'm asking for money, I'm also asking for them not to leave completely and come back. If they come back, we'll be most delighted. But then that leaves the diaspora non-existent. So we are happy with them being out there. But then, in their own little way, when they come back home, they can spend some time with us and do some work, or train people or do something on the ground. It will very much help. I know I'm going to get a real backlash from my year group when I go on the platform, but it's something I'm very passionate about, and I thought I should mention it while we're at it. Okay, so
you see why you are the project ambassador. So back to what Bettina said. Bertha, well, you're right. I mean, you'll be able to help remotely. One of the things we've done with the design of the entire project, we actually laid fiber optic cables for internet supply, and that was gladly done for us by Vodafone. And to make it possible and much easier for us to have you support us remotely. But ICU is ICU, you need to be physically here. You should be able to look at taking turns. I've had a conversation with Dr. Payne Finn, also part of, I think, one of this.
Yes.
I'm right. I'm sure you know her better.
Yeah, she used to be she's the immediate past president of Ghana Physicians and Surgeons Foundation, and we're both very passionate about wanting to give back. So I'm sure.
Absolutely. The challenges with management is real, and it's been part of our key issues. I mean, deliberations with government. We can't treat this infectious disease center just like we treat every other hospital in Ghana. The facility will die off in minutes. Okay, to be ill run, that's a fact. So what we've recommended is that together with the existing facility, be merged as one unit and then elevated into a national center and form the basis for a CDC, directly managed at the Ministry of Health level, directly, all right, with proper budgetary provisions. What we are going to try and do as a fund is actually try and get a maintenance fund in place. So the key infrastructure, maintenance of it, we'll be able to make some provisions for it. We are putting insurance for up to about $8 million, to cover the facility as well. We are going to support it in every way we can. What we've done is also get corporates to adopt particular wards, and then they can probably help with some of the maintenance and sustenance of the entire place. We're going to try as much as we can, but it also needs government real commitment. You can't run a CDC like the way you're running a municipal hospital or a polyclinic. That will not work. And for a facility like this, elevating it there can actually get a lot more funding from research institutions across the world. People really need to research infectious diseases in Africa. It's not effectively done out of Africa, so it's better done right here in Africa. It's much easier for you to get what you call them, or which is this what is your a Mayo Clinic or any of them trying to partner our facility, but it will require us to elevate it properly, and that's what we are advocating for as of now. It'd be great to have your voice also added to this entire case that's been championed by myself and Justice.
Yeah. Senor, but how do you okay, go on, Dr. Justice.
Let me just add something quickly. Senor laid the foundation, but this is just to assure better that, look, one feature that probably we haven't highlighted on is the fact that we designed and built it such that e-health is actually going to be integrated in the care. So all the telemedicines and all the bits we were talking about, we have provided infrastructure for safe, such that you can have a consultant, say in Kolebu, and with the right, software and communication gadgets, you can actually see a patient in the center, or you could be in the center and be seeing a patient at, say, Ridge Hospital. So we have provided the infrastructure
actually
for that
health
activity within the center as well. So those are some of the complementary things we added. And I'm happy you've also mentioned the collaboration between Ghana and our colleagues who are out there. I mean, as General Secretary of the GMA, I'm always in touch with our colleagues out there. The foundation has some partnerships with that. We attend your conferences. You also visit the GMA house and all that. So we think that we should be able to rope in everybody to deliver healthcare to our people. And it's, God's own wisdom. In his own wisdom, he decided to make all of us Ghanaians. And I think that as we move on, we should be able to give something back to the country.
One of the recommendations we've made is to have the lab hyped off and handled and managed by Noguchi. Noguchi has a more structured funding source. It has a lot more professional expertise and all that. So if we actually have the lab fully managed by Noguchi, it becomes an extension of Noguchi with better capacity, much closer to the direct treatment center. And that is one of the interventions we hope will be favorably considered by government to have it done. I saw a question out there about government. Government has been very, very supportive of the entire project. This project is a private-public partnership. The land doesn't belong to us. We have full support from His Excellency the President, the Minister, and the whole people of Ghana. We've had donations coming from people from the opposition and people from the current government. We've had state-owned institutions at the Bank of Ghana, the Ghana Gas Company, GNPC, all support this project. We've had We Power Authority support this project. The same, we've had the private sector like EcoBank, Fidelity Bank. We've had the Ghana Association of Bankers, CH Group, and good friends like Dasuki, my good friend, Project Ambassador, Dr. Bohine herself brought, we've had everybody, 10 cities, 1 city. So please, it's not a private sector versus government, public sector competition out here. It's a collaboration to deliver compelling value to the people of Ghana, and that must be celebrated.
Absolutely. So we've got a question on the screen, Senor. How do infectious diseases specialists in the diaspora get involved also?
Okay, I think it's very simple.
Okay, go ahead, Justice.
Look, I think it's very simple. We are going to ensure that the right structures are put in place. And that means, as we have all discussed, we get our brothers and sisters who are out there to be a part of this. So as part of our handing over to government, the technical handing over aspect, we are discussing all these things with them. And I'm sure within the next, let me say, within a very short time, we are going to come out with some of these modalities. And then we'll share same with all our colleagues who are in Europe, in North America, those in Asia. We'll share all the bits with them, such that they can all appreciate and know exactly which roles they can play. If you want to volunteer, it's okay. If you want to support in any form, it's okay. If you want to come in here and provide service, maybe on temporary basis, we as the GMA are prepared to liaise with the Medical and Dental Council to ensure that you have a temporary license, for example, to help you, see patients for short periods. And those who we think we can leverage on, the good relationship between the association and the council, facilitate their licensing or relicensing so that they are reinstated in the books as practitioners who can actually work here. And as and when they need to come in, they come in. And with the help of the telemedicine, resources that we are providing, you can sometimes even be out there remotely and still be able to help. Of course, we are looking at situations where research and all the bits will go on. So if you find yourself in the diaspora, but you can help bring some research, into the country, it is all welcome. We want our people out there to look out for grants, for example. Some are in very well placed positions to get some of these things. The grants will be channeled through the facility because of what will be done there, and ultimately will also help improve care. So it is not only about care for the patients, but research, education, teaching, all of it are incorporated.
Fantastic. Thank you so much, Doc. So those of you who are watching, please send in your questions now. If you have any questions that you'd like to ask the panel, this is the time to do so. But Dr. Bettina, how do we make sure that, people are not using it as a regular hospital, that they know the difference, that this is a specialty hospital? How are we going to be, doing the right communication to make sure that it's not seen as just a general hospital?
Well, I think in our profession generally, can you hear me? Can you hear me now? Okay. So in our profession generally, as Dr. Bertha and Dr. Yangson will tell you, we have a structured system where, for example, if you needed to go to hospital, you would go to a first center, you'll be referred to another center, and if you have to go tertiary, and now we even have quaternary. And the infectious disease center is very specialized. Unfortunately, or fortunately, you can't just walk in. You really should have been referred to the center because you should have been seen, for example, in this COVID era, you should have been seen and diagnosed with COVID. And there's a structured system where we go through the districts, and the district health directorate will then arrange if you need to go into a center to be looked after. So luckily, it is an unsaid thing, but it's a thing that even we in private sector know that. So we tell our patients, the word out there is that if you feel unwell under these circumstances during this COVID, you don't just get up and walk into a hospital. There are lines, hotlines that you call. I know there's some difficulty there, but government is doing its best to be able to make it work as efficiently as possible. But then, even if you go and see your primary healthcare doctor, or you come and see a GP like me, it is likely that we'll have you tested and then you'll be referred to the center. So as much as we want everybody to have access to it, we cannot have it being an open door policy where anybody can walk in. I think as healthcare personnel, we should take the opportunity during this time to educate our patients and let our patients know what is right and wrong. Dr. Yankin will tell you that, and Dr. Bertha as well when she was here, that people just get up and then walk to Kolibu, and then they expect to be seen, as per normal. And that has changed a lot now because the health service and Ministry of Health is doing quite a lot of education, telling you, go to your primary healthcare physician, and if they need to refer you, then they refer you to the center that you need. So this is kind of a subspecialized center, and people unfortunately can't just walk in and ask for care, especially during this COVID time. The Ministry of Health, I wasn't able to go for the opening or the official opening because I was a bit poorly, but the Ministry of Health has pretty much they've had some sort of a handing over ceremony. And therefore, what pertains in public sector in all the other hospital is the same thing that is going to happen in this particular subspecialized center. So I don't know whether Dr. Youngson has anything to add to what I've just said.
Well, I think by and large, you've basically, gone through it. It is one that you cannot just be walking in as if, in code, with all due respect, you are entering a market or a super, market or a mall or something. No, you will need to go there within the structures of the healthcare system. But knowing the kind of country we have, sometimes it's a bit difficult. So as part of the design, we intentionally created a holding area for patients who, for some reason, may end up there and the diagnosis is actually not properly confirmed. So then you will be the holding area whilst we use our laboratory and other diagnostics facilities we have within to really get a full grasp of the diagnosis. But by and large, you need to go in through the formal structures, and as a specialized facility, you basically will have to go in through the referral system. And that's what Amma has just, described.
Fantastic, fantastic. Keep your questions coming in. I can see your questions flowing right now. This is the time that I'm going to be asking you, the audience, to put in your questions. And so what systems are in place for disposing infectious waste safely?
And then, Tom, maybe before you get to that question, what I'd like to add is that even in the US here, I was telling you that in the last 6 years, they've done a lot in terms of strategically setting in place a tiered system for infections. So they have 10 specialized pathogen treatment centers, including Johns Hopkins, Massachusetts General Hospital, and a few others. And they have 63 treatment centers and a few what they call frontline centers. So you don't even just get to before you even get to one of the 63 treatment centers, you need to have been assessed. And then you're going to be moved from a treatment center to one of the special pathogen centers. Because like I'm telling you, if they spent maybe $20 million on a treatment center, it's highly technical. The elevator that even leads to the patient rooms are different. Just like Senor and Co have built up something that is very highly specialized. So of course, taking care of even one patient in that place is extremely expensive. And so before that patient gets there, they need to make sure they've been screened, because today is COVID. Tomorrow it could be smallpox or plague or Lassa fever or something that is extremely or highly infectious with a huge public health significance. So it's not everybody. Otherwise, the place will get choked. And the word abuse comes from abnormal use. If you start using it abnormally and just seeing everybody there, very soon, the place will be full. And when you really have an anthrax patient or somebody who needs highly specialized care, you won't be able to get it. So I think the referral system is very much in order.
Thank you so much. Thank you so much. For those of you who have just joined in, we are talking about the Infectious Diseases Center that was built in less than 100 days right here on Ghana soil. And so we are speaking to the people who are behind it. We're speaking to an infectious diseases doctor specialist, and we're speaking to Dr. Amma, who's also very influential in terms of getting people to support the cause as well. Now I'm going to be diving into questions that you guys have before I finish my questions for the panel. We are going to be wrapping up in the next 30 minutes. So I want to make sure that I get in all your questions that you have. And if you are watching for the first time, make sure that you share your pages, make sure that you subscribe and you like the Dentist Show page. So right now, Chrissy, I'm ready for the questions. Let's roll. Okay. Dr. Justice, can you read this question?
Yes, I can. Do you want me to read it aloud?
Yes, please.
Okay, this is a question from Kablan. He says, I know some of the panelists have touched on maintenance. I'm very concerned that maintenance could be the major stumbling block to the longevity of this wonderful facility. Is there any system in place to ensure that when the Ministry of Health lacks in its duty, there's a plan B to fall on to maintain the facility?
Well, in response to that, yes, the Ministry of Health has primary responsibility for the maintenance and management of the facility. But what we are doing is to put up a fund to support the maintenance of the facility. We are trying to get corporate support so they could vote part of their CSR budget towards the maintenance of the facility. But that's supposed to be a second level care or maintenance strategy for the facility. The primary one will have to come from government. And I think brings you to focus some of what Betha was saying. And asking what exactly, I don't know if it was Betha or yourself, Denta, what exactly the diaspora can do. A lot of you are well connected with the research infrastructure, medical research infrastructure in the US, in the UK, generally in the West. How do you bring that influence to bear on such facilities will be key in the sustenance of this entire facility. If you have a Johns Hopkins University strategically partnering this facility, or you have a Mayo Clinic strategically partnering this facility, I think that we're actually be now elevating it properly and sustaining it properly. Just like we have had with Noguchi. Noguchi is very actively supported by the Japanese government because of Noguchi. But beyond that, you have strategic alliances with certain research bodies and training facilities that can help generate income for the facility and make it and keep it sustainable and viable. Look, it is not a luxury. This facility is a necessity for a serious country. And if we really want to be the LMIC, a lower middle country that we are, we can't be boasting of being a lower middle income country without an infectious disease center. It's an embarrassment, to say the least. So fixing this and investing right to support this infrastructure is one that must be the priority of any public health administrator in this country. So we expect that priority to be given it. The CDC status should go to support that. And all of us should get involved, just like how we develop this project in a public-private collaborative effort. We should also participate in trying to sustain the facility. It will be critical one day. It could be you, it could be me, it could be one loved one of ours who need this facility. And when it's absent, we'll be on the sorry side of things. And that need not happen. We all just need to get involved.
Absolutely. And can you answer the question about how the waste is removed?
Yes, waste management has also been factored in there. You have all kinds of waste from the PPE itself that will be disposed. We have, and also with the liquid you have in there. We have a sluice machine. We have autoclaves in there. We have general waste management systems in there. There's a waste management system already existing in the hospital. We are leveraging some of its facility. The movement of it is there. We also have a company with expertise in biomedical waste management who we are contracting to support the facility over the next 12 months.
Fantastic. Did anyone of the panelists wanted to add to anything that Senor had said?
Well, the little bit I want to add is this. The trustees, in their own wisdom, have also signed some SLA, so some service level agreements. Senor has mentioned one with the vendors who were involved with supply of equipment and installation and what have you, to ensure that there is a routine or a regular maintenance schedule to make sure that the lifespan of these, gadgets and facility we put out there is really, really one that we can all, be proud of. We don't want it to fall into decay, like some, facilities in the country. It's sad to see some of these things. So short to medium term, some of these SLAs and warranties and what have you that the trustees have taken seriously is also going to be part of the approach to ensuring that the place is well maintained. So there's going to be scheduled maintenance of the equipment that we have in there so that we can see it out through the required lifetime, not an ad hoc based kind of approach. No, we don't want something of that nature. So we signed the SLAs, and these are some of all these are going to be handed over to the Ministry of Health. But the trustees are still going to ensure that they push the vendors to do what is right for the facility.
Fantastic. Senor, can you take this? Can you read this question out loud and answer it for us?
Okay, this ingenuity is great. Congratulations. Please, I wish to ask if there are plans to collaborate with our local universities offering medical programs to help train enough specialists for the future. One, the facility is just a stone throw from the University of Ghana Medical Center. I find no reason why, as a training facility, we shouldn't really make it a primary facility for training that will be leveraged from that medical center. The University of Ghana must have a strong hand in this. You should definitely have Noguchi, as we've already recommended, taking a strong hold over the lab. And that should actually set the base for proper training. And it will not come from anywhere. It will still build the universities that we have in here. And the rational thing to do is actually now have it partnering or being a strategic feature in the entire University of Ghana medical training system. When we go to Kumasi, to be the same thing. I think CAT will have to also have a certain influence and hand in there. You go to Tamale, they're going to have a similar thing. If you go to Tapra, the closest medical school would have to also leverage on that facility to train people. So that's I think a logical conclusion as far as this facility is concerned. It shouldn't be seen just as a treatment one; it should be seen as a research and training facility as well.
Fantastic, fantastic. Can you answer the next question as well?
Someone is asking. I think Sandra is asking if the facility will be on solar, and we have an independent water supply also. No, it's not on solar. We rather have skylights to minimize the dependence on electricity powered facility. It is green because it has other features, insulation all around to minimize the consumption of power in the facility. And all that has contributed to it being EDGE certified. We expect that power consumption in the facility should be about 30% or so much lower than would have been. It's been reviewed by EDGE or IFC of the World Bank and be certified as such. We would have considered actively solar, but the next project will be considering solar more on the heater side. We couldn't do that this time because of the speed we required and the supply chain challenges you had locally and globally. If we're going to depend on that, that would have been quite difficult to really pull off in time. And time was critical. One of the key things in trying to get and rally everybody around was a mantra that we kept sounding in the ears of everybody. Every day we delay is a life we are throwing away and risking away. And it was not in anyone's interest to risk a single life. This facility is intent on saving lives, and speed was critical to be there in time to save lives. And I'm happy and proud of the team that delivered it, the both environment professionals, the military, and everyone who rallied around together the medical consultants we had, Justice and his colleagues, in supporting and delivering this in record time. Very, very proud of the team. I wish we did it much earlier, but this is big record time as far as Ghana is concerned. And congratulations to that entire squad.
Absolutely. Dr. Justice, can you take this question, please?
Okay, it says, this is from FY. It says, how do we ensure it serves those in need and not those who can pay someone or know someone? Which systems are in place to limit corrupt and abusive use? Truth is this: if we are going by the clear principles as we discussed earlier, the referral system into a specialized facility, it need not be a question of who is rich or who is poor. It's about who requires the services that that facility can deliver. So baseline, you could find yourself in, say, Kaswa, Winneba, wherever, and if the attending doctors believe that, look, at this point, you need to be sent to this facility, the referral will be done. The necessary, communication between the two ends, where you are being seen and the facility will happen. Ambulances are going to be available, and in fact, we are going to give the facility an ambulance as well. We're giving them a car for their administrative purpose, but we are going to put an ambulance there as well. So it will help convey patients. So it should not be about who you know. We know it's a system that sometimes creates problems. But for us, this is a specialized facility, and it's to be used for patients who require the services that facility can deliver. So we don't think that this will form the basis for any of those things. As for issues of abuse and corruption, Unfortunately, we cannot determine today, but we have recommended strongly that there's going to be straight use of electronic, medical records keeping and what have you. So everything in there is going to be electronic, not paper. Two, we have requested that only competent people with the right expertise and attitude to work should be the ones who will be manning and working at the place. So it is up to the Ministry of Health and the Ghana Health Service or whichever agency will be involved to ensure that people with the right attitudes and practices are the ones who are put in there. Those of us who were involved, we never had a CD from this. It was rather our own resources that we channeled into. We did this pro bono. We were lucky to have great people like Ama, who also went out there to look for money to put in here. And none of the trustees involved is a man of straw. These are men of substance. Their interest was not to make money. Their interest was to put up a facility to help all of us. And they committed their own personal resources and time and expertise for us to get there. So as far as the Ghana COVID-19 private sector fund is concerned, issues of corruption should not be on the table at all.
Yeah. Sorry, Denta, can I just
fantastic.
come in?
That's good to know. Yes, please.
Yes, I just like to add this. I mean, with regards to who you know and all of this, I would like people to know, just to have a sneak preview into what has been going on with this COVID-19. Trust me, people don't look at anybody's face. The doctors and the nurses who are working day and night, all they want to do is to make sure people get better. I've been at a couple of the treatment centers and I know how they work. It is just a matter of this person is a human being. We need to get them in there and get them out. In our profession generally, it's very difficult for you to pick and choose who you see. And I must say, and I must applaud greatly those who are working with the patients, the COVID patients. They're doing an exceptional job. UGMC is amazing, and so is GA East. You see them working day and night. Some of them don't even have any rest. Noguchi is amazing. And therefore, I mean, I don't see much of knowing who is who before you decide. If somebody has malaria or if somebody has high blood pressure, if it's a cold case and it's not an acute case, then you can say that, oh, I'd rather see Mr. A because he's coming from private sector and he's a bank manager before I see Mr. B. But in this acute phase, in infectious disease, trust me, nobody has time, to start asking who is going to take bed 1 and bed 2. I work with a lot of high-profile patients, and I needed to get some high-profile patients in. And if there's no bed, there's no bed. I mean, they don't care who you are, really. And if there's a bed and it has to go to Mr. B because he's the one who came in first, and the space, so be it. So I must applaud people who are working on COVID-19, and I know that other infectious disease. I mean, this center is going to be dealing with other infectious diseases, and they are going to work very hard. The last thing I'd like to say is about corruption and all of this. It boils down to us, the individuals. You can put all the structures in place that you want. It will stop it to a certain level. But the average Ghanaian or the individual should know what is good and what is not, and we are getting there. I mean, I've only lived for 50 years, but at least what I've seen in my 20 odd years of being a doctor, things have improved significantly, even with regards to maintenance. You go to a place, and maybe 10 years ago, you go to a place and places are just deteriorating. But now people are beginning to value the money that has been put in things and are giving themselves, a pat on the back and saying that, what, we're trying to maintain this. So I'm sure it will succeed. Just as Justice has said, the structures have been put in place, and we just need to change our mindset.
Fantastic. I'm sure it definitely will succeed. And so I want to know, Senor, about the Kumasi one. What are the plans for Kumasi? What can we do to get involved? What are the plans?
Well, we are hoping to roll out Kumasi by end of Q3. That will be end of September. We need to wrap up. Accra with the final commission of all the equipments, which is ongoing right now. We're training the officers from the MOH. After that, strong planning is going to continue. We already commissioned a team, I think about a month ago, to start recce work on Kumasi. We should firm that up next month and start in September, towards the end of September. Still donations are still welcome for both Accra and Kumasi. And there's a lot more equipment we can add to the laboratory. We want to get it to a level 3, so a few things we are going to be adding. We're adding a safety cabinet, a number of safety cabinets. We're increasing the PCR capacity as well. There are a few centrifuges we are adding to what we currently have in there. But Kumasi is key, and I expect the Osekrum brothers to own their town. The Osekrum bloggers must own this town. It is your game. No Accra game. You must seize it with all the swag. We didn't see a very strong representation from the diaspora as far as the Accra project is concerned. But we hope that with all the excitement and the track record we've proven in the Accra project, we should see the bloggers from the Bronga Hartford to wherever it is to really take and own Kumasi. Kumasi is supposed to feed the middle belt. So the Bruno people, the Ahafo people, and then the Ashanti people must own this. You go, we shared a link with you, Denta, from the diaspora. It's much easier for you to.
Yeah, I've just shared the link.
Yes, that link works easily. It takes Visa, MasterCard, any options you have. We also have our bank details if you want to transfer directly into our dollar account. It's with Fidelity Bank. It's also on.
Can you put it on?
Let me put it this way. You could visit the website at GhanaCovid19Fund.com. Hold on a minute. COVID19Fund.com. And you just click on the donate button. You have all the payment options. But with the diaspora, I recommend you have this. Some people have had challenges with the visa option directly on the website. This is also on the website, but you just use this. It's easier for you. We welcome all donations, and we're acknowledging everybody. For those who donated, your names are going to be etched on granite on the buildings that we have. We have a donor wall. So depending on the level of donations, we recognize it, and your name is printed in granite. The donors, Amma brought, their names are in the etched in stone, and it will be there in perpetuity, and everybody will appreciate your participation in this project. It's something to have as part of as part of the things you have in your store, that it can be known beyond your life that you participated in trying to save lives through this project. It's not going to compensate for whatever. It's your real gesture, and that love has to be seen and shared, and we should encourage others to participate in that. Kumasi is starting in September. We need to mobilize funds, and that fund mobilization is starting now. We need a base fund to really start. Government, we hope, will participate in the process, but this is a public-private partnership, and we expect to see a strong showing from everybody, and this time a big showing from the diaspora.
Exactly.
Senor, you guys have done a fantastic job. Honestly, the more I hear about it, I'm just so proud to be Ghanaian right now, that something like this can happen in less than 100 days. It's incredible. And you can see from the comments that people are just saying that this is historic. This will go down in our history books. I mean, COVID-19 is already in the history books, but what Ghana has been.
I'll tell you something. When we started, the team itself couldn't believe that it was achievable. So while I knew that we were going to have to tweak the timelines, we gave them an audacious timeline of 4 weeks, then 6 weeks. All right, we modified, and you need it. You see,
you gave them 4 weeks. 4 weeks.
Oh yeah, I had to put 4 weeks in their brains, so that once you put 4 weeks, you aim for the sun. You hopefully get the moon. That's what happened. It's not happened in Ghana. People are not used to working 24 hours. People can't understand that things are going to happen at the same time. You come from a country where people think when you are building a house at the stadium, you have to leave the house for you to beat the house. That is the thinking that we have in Ghana. That orientation had to change. And people had to see that it was beyond norm. You were out to save lives. It was not just another project. It was not another architectural feat, engineering feat. Hell no, not. It is about saving lives. And time is of the essence. We work 24 hours. We had engineers 66 years old working in the morning, sitting with me at 7 o'clock and closing at 2 a.m. and driving possibly about 20 kilometers back to their homes. Look, the sacrifice shown by the men on ground is unbelievable. They themselves couldn't even believe what they were doing. They woke up one morning and realized, geez, we did it. I said, yes, it's always been in us to achieve it. We easily just fail to dream and believe it. But once we believe it and we move, we will make it. And yes, we made it.
I love that. I love that.
And I want to say that Senor and Doctor, the two doctors, I'm full of admiration and deep appreciation for everything that you've done. It's just mind-blowing, amazing, and I know that information should go around the whole world. So a big kudos to you for all the hard work.
Thank you very much. But just to add a quick one, the fundraising we are talking about, we want people to have faith in us.
Right.
Look, the trust has been structured such that the governance systems are solid. No trustee handles any money. We have worked with world-class, organizations like the KPMGs, the Stanleys, the EcoBanks, the Fidelities. These are entities who work per professional standards. And they were the ones responsible for handling finances, not us, the people involved with the trust. So you can be rest assured that if you donate to any of our custodians, i.e. EcoBank or Fidelity, it's in good hands. We have Stanley as our fund manager. We have KPMG as our accountant. And look, we don't give room for anything that will be untoward. These are organizations, and Ernst & Young is also our auditor. So these are organizations that, technically speaking, have a reputation to protect. And they are out there to do what is right. And that has been the mantra of all the trustees. Nobody will be shortchanged in any way. And we urge everybody who is touched by this to ensure that, look, we contribute to what is yet to come. This is just the beginning. What we have done should be the motivating factor for all to see that, yes, together we can. And we should be committed to what is ahead of us. This is done. This is gone. What is ahead is even bigger. And we need the support of everybody.
Hi, Denka.
Yes.
Look, these guys, I don't even know why they hired me, or they hired me for free as a brand ambassador, because the ambassadors themselves. But Osei Chrome guys, I'm coming for you. I mean, people see me now.
Yeah.
They're worried because they're like, Doc, now are you a doctor or are you a fundraiser? Or we don't see you clearly. And I'm like, yeah, everybody needs to get involved. And what I can say to that is that in your own environment, for example, if we're taking it to Kumasi, yes, it's not going to only serve Kumasi, but what a joy it will be if you have that plaque out there and you have your name there. It is not for now, it is for posterity. People would see it and know that you contributed to a worthy cause. It's not going to be destroyed. And I know there are some of the donors, and that's what I was just going to mention, who do not want to be known. I am so sorry for this particular purpose. We want your children and your grandchildren and anybody associated with you and even remotely associated with you to benefit from your largesse. And therefore, don't be upset if we just put your name there just for what it's worth. Because if you do some things that are so amazing, we need to give you the due regard, as it were. And The diaspora, I'm coming for you guys. I mean, you should know that I will do it without even blinking, because now we have something to see, and we are so proud of it, and we know it's going to be properly run. So then you know your money is going to go towards a worthy cause. So Senor and Dr. Youngson have said it all, but I'm still going to play my role until people start throwing me out of their houses and people start blocking me on their WhatsApp and all of that. I'm just going to do my work and try and do it to the best of my ability. And Betha, yeah, we are happy to hear an infectious disease specialist. That is amazing. We're really proud of you. But with your people, these Ghana college people, I beg you, there are people out there who are making some good money. So I'm going to appoint you a brand ambassador yourself, so that you can also raise some funds for us,
Yes.
for this project. The point I'm making is that we should all get involved.
Yeah,
And,
definitely. Definitely.
Yeah, nothing is too small. If it's whatever, $500, 1,000, and beyond, we're more than happy, to help towards a worthy cause.
Ghana, how do you feel when you see something like this done by your fellow Ghanaians? Teamwork makes the dream work. We saw the visuals, and this is it. This is what it looks like. This is something that was built in less than 100 days right here in Ghana. So anything and everything is possible if you put your mind to it. All of these things that, we say, oh, it can't be done in Ghana and the systems don't work. All of these people came together and made sure that we have a first-class Ghana Infectious Disease Center. And they're not stopping there. They're going to Kumasi, they're going to Tamale, and they need your support. We all need to come together. Senor knows that we are going to be supporting through Private Hammond. Private Hammond was raising funds for the veterans and to support frontline workers, but we are going to put a portion of some of that funds into this because it's part of supporting frontline workers. If we don't have the right places and the right hospitals for frontline workers to work in, then, what is the point? And so we are also going to be dedicating some of the 40, we've managed to raise 41,000 so far. We are still pushing and making sure that we get more, but we will be talking to Senor to make sure that Private Hammond, the 95-year-old veteran, gets his name written on the donors wall, which looks like this, and so I think it's wonderful to have, it's wonderful to see. Even me, I want my name on that wall as well, and so I'm going to be making sure that I raise funds and make sure that my name is written on that wall. Even the Goober Foundation, so the Goober Foundation team, we have a task, to make sure that we have our name on the wall. And I think it's something that, for years to come, when somebody goes on that wall and reading about 2020 COVID-19, your name is there and it will never, ever be forgotten. The website is on there, www.ghanacovid19fund.com. I'm sure you are blown away by this amazing facility that was just done in 3 months. It's absolutely incredible. Chrissy, let's put all the congratulations message. I just want to blow Senor and the team's mind, all of the fantastic comments that we are getting, to encourage them and to keep them going. Kumasi is a whole new, every city that they go to is a whole new challenge, but they will make sure that they stand firm and they get the job done. And we, from the diaspora, the people of Ghana, are going to support. Because like Dr. Amma said, COVID-19 it doesn't respect who you are, what name you have, what title you have. It can happen to any of us. Any disease can happen to any of us. And so it's important that we have the right facilities in our country so that we don't have to fly out. A lot of people in the diaspora are always like, oh, when I come, what about health issues? Do we have the right hospitals? And these guys have set the bar very, very high. So again, I'm sure you can see that, well done, Senor, and the team. Real proud of you. God bless you. Loads of comments coming. Love you. They are proud. And it's just fantastic to read, honestly. Before we go, I don't know whether Dr. Bertha, you have your last closing remarks on, again, stressing the importance of having such a facility in our land.
Oh, clearly, thank you, Denta. Clearly, this is a very, very welcome initiative. Like I said, I've been incubating something like this for about 10 years. So for me, this is extremely exciting. And I mentioned it on Saturday. It's exciting, and I'm going to do whatever I can to get a lot more people on board. Me, myself, get on board with giving. I think when the COVID-19 outbreak came out, the Ghana embassy here was raising funds as well. And so most of the giving that a lot of people around here gave was towards that. But I think now that we have a structure on the ground, we're going to do everything that we can to raise funds to support it. And I want to encourage all our viewers to give to the fund, support it, and get more infectious disease centers out there. And from our perspective, we're going to do what we can to make sure that we have the right appropriate manpower sometimes people think, oh, let's just get healthcare workers. And if you talk to any doctor, they'll tell you healthcare workers don't happen overnight. I mean, Dr. Amma sitting there has spent several years medical school. It doesn't happen overnight. So the few that we have to look for them, harness them, and make sure we put them to the appropriate, make sure they're contributing appropriately to the country. So I'm really proud to be part of this panel and excited for the future of infectious diseases in Ghana. And for those of you who are just joining us, I see some people asking, how can we help? You can donate. And for those who are infectious disease specialists, come and let's work together. Let's team up with those on the ground and not give only just our money, but then our talent and everything that we can to support Ghana. So thank you very much.
Thank you, Doc. You have a question on the screen.
Somebody was asking about hydroxychloroquine. We're going to be talking about that tomorrow. We have a lecture coming up tomorrow at 6 p.m. Eastern time. I believe it's 10 p.m. in Ghana, but we have I've lined up the Ghana FDA pharmacists from Ghana, 2 infectious disease doctors. Dr. Peter Popolampo, who said he gave a lot of his insights to the building of this institute. He's the head of an infectious disease in Kobe Teaching Hospital. He's going to join us tomorrow to talk about chloroquine and COVID-19. I think it's a bit larger than we can achieve during this particular discussion.
Fantastic. Somebody said, can you show the building again in case someone hasn't seen it, please? Okay, I will definitely show the building again. Here it is. For those that missed it, here is the wonderful building. Yes, I've also shared the link, right?
To play a bit of the beginning part of the YouTube link I sent on the excerpt. It gives a better picture of the building than what you put up there.
Yes, that'll be great.
Yes, unfortunately, this the StreamYard doesn't allow videos, but I've put the link on there so people can go online and view it. But Senor, I'm going to be coming to the facility to do my own proper dental show and show the world the facility. I'm excited to come in there and see it. So viewers, don't worry at all. I will be coming to show you everything, every corner. I'll be going there to make sure that you see everything as it is. Sometimes pictures doesn't, when you see it, seeing is believing. So kudos to you and the team, Senor. And I know that, Edward Efar, you've had, a fantastic team. Who were some of the people that were on teams? Just to, name a few.
Well, so we have Dr. Otinjesi of Tropical Cable and Conductors Limited, Edward Efar, Fidelity Bank Chairman. We also have John Taylor of Woodfields, Kweku Bidiako of CH Group, Thomas Swanika of Svani Group. You have Kusichum of Multimedia Group, Julie Isiam, who is a commissioner at the GRA. You have Omani Frimpong of Wilkins Engineering. we have Dansaki of EcoBank, the MD of EcoBank, also a part of it. Myself also a part of it, and I think I'm missing somebody, but it's really escaping me now. We have got a number of folks, plus all the key administrative support people like Ernst & Young, Stanlib, represented by Mr. Emmanuel Alex Osiedu, the CEO of Stanlib. Stanlib is the investment bank arm of Stanbic Bank or Standard Bank South Africa. We also have Mr. Julian Opuni, who is the MD of Fidelity Bank, also a part of it as a custodian. And you have Mr. Anthony Sapon, who is the managing partner of KPMG, being the entire fund accountant. He's supported by for this particular project, the project partner, who is Mr. Kwame Banier and his team as well. It's been a fantastic one. Yes, Mr. Kwame Banko, Sikins, Alita. If you should know Sikins, of course.
Of course.
You should also know Alisa. He's the one I was missing. Yes, the Kwame Banko has been very, very supportive in this entire, and he's a trustee, very, very active trustee, if I should say so. I'll send you a picture just before we go. So I hope that probably give viewers a bit of an in on what's happening in there. This is what I just sent you is a picture of the lounge. There are a few more. I'll be adding. That's just a waiting lounge at the facility. Oh geez. I hope you've received that.
I've got that. Yep.
Yeah, I'll send you a few more. So, but that's fine. We could probably look at others later. Yeah, you go online, you find a lot more of the pictures, and the videos are very, very helpful.
Fantastic. And are you on social media? Is there Facebook? Is there an Instagram that people can go to?
So you can find the fund at Ghana COVID-19 Fund on Facebook. You can also find us at GH COVID-19 Fund on Twitter. And we also have at GH COVID-19 Fund on Instagram. You can follow us there.
Fantastic. Okay, Senor, please mention my name too. Enoch?
Yeah, Enoch is one of Anokweku Kwakunaka is one of the subcontractors who did the joinery work. I mean, at the facility, and he did a fantastic job. At the reception, let me just send you this picture. I think you'd love it. Right at the reception, the exact image you find, the furniture that we have there was made by Enoch. Is just a local carpenter. Local content was a major feature in our entire strategy. We took content very seriously in this entire. Yes, you should have. That's a picture of a waiting lounge at the facility. And I've sent you something at the reception. And the furniture you see in the background was done by Enoch.
Oh wow!
I'll be happy to hear that. Enoch will be very, very, very happy. Yeah, because we had speed. Some of the companies were engaging hard challenges. So we had to go with any professional we knew who could do it. And he was one of them. We just had to micromanage a bit because we needed to fund him to get things done. And we had something called an intervention team that tried to help and bring every work hand that was possible to get this thing done in time. And he did a fantastic job.
So now the Kumasi one, how do people, bid for jobs or, people that have expertise in different things, how do they get involved, Senor?
You go on our website. If you want to be a vendor, there's a place to register. If you want to be a volunteer, there's also a place to register. We'll reach out to you, know what you can do. And one of the things that's been celebrated is the entire cost of the project. We've done this at $7.5 million, and $7.5 million is inclusive of the services we got pro bono. We are spending about $5.5 million in cash, but we had engineering services from the both environment professionals for free. That's not going to happen in Kumasi. They've done that for Accra, but in Kumasi, they are going to be paid for it. But you also have to factor in the value of those services, inclusive of we also added the tax waivers we got from government. they waive off VAT on all the services we procured to the extent that we quote about an estimated $1 million was also waived. When you factor these two, 1 million, 1 million, 2 million on top of the 5.5, we estimate the entire project to cost $7.5 million. If you should check similar projects and the cost of it across the country, you realize that possibly with the standard hospitals, which are not as sophisticated as this one, the government budget should be able to fund possibly about 5 or 4 of these. And that efficiency has been brought in by virtue of the transparency and the openness we've had in the procurement system. If you enter our war room, which I call it, it's very interesting. Everybody, any Ghanaian who enters is entitled to participate in the procurement process. You are entitled to question any supplier. Bids are open right there and then. We don't keep bids and anybody go and make any adjustments to anything secretly. Everything is done freely, gadochi, as some people would say. We negotiate for every person as possible. One of the key guys has been Atabedo, our procurement specialist. He's been very, very supportive. He can pursue every person at any point in time. We need to save every single person possible to be able to save as many lives possible. So we don't take it as we do with government. We will chase every person, we will chase every dollar. And we thank every vendor that has been part of it. Mendana and Sosa, who are the main contractors, have also been quite great in this process.
Thank you so much. We are going to wrap up now. So if I can have Dr. Amma, your last words to the diaspora, to people watching. I know you're going to be chasing people for money, but please stress on the importance of us all coming together to donate.
Well, as I said from the beginning, for those who missed it, it can be just anybody. You may be in the diaspora, yes, and that is great, but you have relatives, you have friends back home, and you want them to go to a facility that will give them very good care. So the expertise is there, the equipment is there, the leadership for running this organization is there, and we're asking you to give and give and give. And it's lovely to know that what you're giving is going towards a worthy cause, and it's not something temporary. Because when we contribute to certain things, it is a temporary thing. But in this case, it is permanent, and it's going to change lives, and it's going to save lives, more importantly. And your name is going to be etched in the sands of time. So I'm just asking people, and cajoling, coercing, whatever word you use, I would come for that money, and make sure that the leadership of this noble and this very, very good initiative will account for every penny, and you will see it in the building, and you will see it in the work going on in the building. Thank you so much, Denta, for inviting me to.
Thank you so much.
Fantastic people who I know anyway, but it's still been an absolute.
Yes, absolutely. Thank you so much, Doc. And Dr. Bertha, I don't know whether you had your last words, but if there's anything else that you'd like to say before we go.
Oh, I am just delighted, and I want people to give and give and give. And I'm also hoping that the infectious disease field in Ghana would grow to the point where we have many infectious disease specialists manning all these places, and people would know that when they're sick, that tale of, oh, I don't know if I'm going to get the best healthcare in Ghana. My vision is that at the end of our lives, when we're in our 80s, we will look back and say, boy, we did this. We took the whole of Ghana health system and the health of the nation to another level and leave the world a better place than we found it. So that's my hope, and I'm really excited to be part of this discussion and everything that is going on in Ghana. And a big kudos to Senor and his team and everybody who lifted one single finger or gave a CD or a dollar to make this happen. So I'm just very excited and happy.
Thank you. And thank you for all the work that you're doing during the COVID-19. I know you've been doing a lot of webinars, a lot of, conversations about it. And I think it's really important that you also be celebrated for the work that you do and the advice and, everything that you're doing with COVID-19 and educating us on it. I know that you were, you have even a slot on TV3 at one point where they were constantly asking you for an update on such on such things. And it's really nice to see Ghanaians abroad getting involved in current things that are happening on the motherland. So thank you so much too for the work that you do, Dr. Bertha.
Right, and then besides that, of course, we didn't know about this project earlier, but Global Infectious Disease Institute, we sent $5,000 to the Chinese students in the Ghanaian students in China who had been locked down because of COVID. We've donated to the Ghana embassy. We've helped with so many things.
Wow.
We paid about $5,000 to $4,000 to help with the live concert that was done by the Ghana embassy. So, I mean, there's a lot of projects going on. So we'll just have to sit back as a board and see how we can team up with the Infectious Disease Center, knowing that that was kind of our vision too. There's no point putting up a lot of structures. Maybe we just got to team up. The important thing is the health of Ghanaians. So that's why I'm saying I'm excited to be part of this discussion. We've done a lot of already, and there's a lot more that we can do.
Absolutely. And I think what is key is, you've mentioned it, I think we need to be doing more partnerships. It's key for our growth. Somebody may have an idea, if somebody else is doing, let's just partner and make it bigger than maybe our idea. So thank you so much again, Dr. Bertha, for coming on the show.
Right, my pleasure.
Okay, bye-bye. Senor, what a great, I mean, you have just inspired a whole heap of people. We just can't thank you enough for your leadership, for encouraging people, for setting that mindset, that mindset change, that mindset gear shift that you mentioned is so important and so vital that, you had to tell them, look, we want this thing done in 4 weeks, so that they get it into their heads that, look, we need to be working fast at a speed. And I'm just blown away. I can't wait to come to the facility. But what are your last words? What do you want to share with the people that are watching today?
History is being made, and you have an option to be part of those making history, or you have to be a spectator. The president has asked us all to be citizens and not spectators. This is time for us to stand up and be counted. It's time for us to be citizens. It's time for us to support this project and save a life. And that life just could be yours. Thank you.
Wow. Amazing, 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 amazing. Senor, thank you for joining me on the show tonight. Like I said, I will be seeing you sometime next week where I have my tour. And the thing that's also inspiring is the fact that all of you have your day jobs, okay? But you managed to do this. We must mention that. This is not your full-time job. All of you on the board, everybody has their own private jobs, but they came together for one focus and one vision to build this facility, and you have done incredibly well. So kudos to you again, Senor, and thank you so much for joining me on the show.
Thank you so much, Denta, for your support. Goodbye. Ciao.
Bye. Oh, absolutely incredible. I'm inspired as well, guys. Look, they work full-time, but they dedicated themselves for at least 3 months or more to put up this amazing facility. Guys, anything is possible. If we put our mind to it, you can do it. You can achieve it. I mean, look at the building, look at the facility, look at everything that has gone into it. The consultations, everything. And so just put in your mind that, sometimes you think it's challenging to come to Ghana. You can't make it in your homeland. You can do it. Having the right mindset, having the right people to work with, anything and everything is possible. If you believe that, say amen. Amen. Guys, it is the end of the show. I hope that you have enjoyed it. It's been great. It's been educative as always. If there are topics that you want me to discuss, as you know, we have the social Sundays where we talk about social issues. Last week, we spoke about fibroids. This week, I'm going to be giving you another good topic. I will share with you by Friday, tomorrow, on which topic that we're going to be going with. But, we're really here on the Denta Show to inspire, educate, and empower you. There's nothing that can't be achieved. And there's conversations that we need to have as a community. Not everything must be hidden in the carpet, but we must be vocal about it. When we are vocal, we encourage somebody else Let's not sit in our shell and you know, do everything ourselves or think it in just in our heads. Let's start communicating. Let's start building the motherland. So again, a big thank you to Seek for this amazing headphones. Guys, you must go online and get one of these headphones. And guess what? When you do get one, you can get 10% off if you use the discount code, which is Dentar VIP. Go online now and purchase your own. The sound is absolutely amazing. And again, to World Remit, the show wouldn't go on without you. World Remit, you can join over 5.7 million people who are sending money worldwide. And World Remit, download the app. It's easy to use from the comfort of your own home, and they get it in seconds, not minutes, in seconds. So you can go online and, you know, make that money transfer. I'm sure there's a family member who needs money, so make sure that you go online and you support. Again, a big thank you to Prodigy for her amazing, you know, spices, all-purpose seasoning. Go online and purchase a product. Let's all support. Again, Ordana Connect, for all of you that are looking to invest in Ghana, invest in Africa, for job opportunities, for partnership opportunities with different companies, that is the website to go on. You can go on there and register. The website will be live in September, but now is the time to register so that we have your details, and we will be sending out jobs, we'll be sending out partnerships. If you're interested in agriculture, whatever it is that you are interested in, we will be able to guide you on how to do it. So again, I've put the details up. You can go on there and, you know, register, which is very important. Again, Vesta London Beauty, her lip glaze is amazing. Go online, guys, and get one. Absolutely, it smells good too. So go online and purchase that. It's also very important that we keep supporting. As I say, keep supporting. And again, last but not least, is another inspiring young lady who is doing these balloons. You need to go online. Let me just put her details up. You need to go online and purchase one. Look, somebody's birthday, you know, let's show some love to that person. A Regal Touch. Go online, go to Regal Touch, and you will be able to get, you know, a gift for a loved one. So go on there and make sure that you order. Guys, thank you so much for watching each and every week. I can't thank you enough. I'm always inspired by the numbers of people that are watching the show, and keep watching, keep sharing. It's really important that we keep this conversation going. Thank you so much for watching this week. I will see you same time next week. God bless you all and have a brilliant rest of the week. Bye-bye.